what the most common question that I get from the distraught family is, am I sinful for taking my aunt, my mother, my grandfather, insert whatever relative, we've maybe even been in that situation. Am I sinful for taking this person off of the ventilator? Am I sinful for not allowing them to stay on the ventilator? Because we see this as a loss or as a supply of life. And so, inshallah, I'm sure there's many Islamic questions that we'll get into, and I'm sure Dr. Qurrat is going to give us a beautiful perspective to that regard. But how can we have just a better plan? Right? Let's avoid that stress. Let's elevate our level of understanding. Like we're better than that. All the rules are already there. It's all written out. We just need to follow them.
Okay. Assalamu alaikum everyone. My name is Qurrat and I'm palliative care physician, as Salma gave my introduction. So first of all, I want to give you a story why we felt the need to talk about this topic. Louder? Do we have a speaker? Okay. So the need that we felt that we need to talk about this topic and encourage and empower our Muslim brothers and sisters is that I work in a hospital and I get to see a lot of patients. And when I see Muslim families and when I see them struggling, I have this question, why we don't prepare? Why we end up in this situation? Because our bodies is the greatest iman of Allah. It is greatest blessing of Allah, maybe more than assets. We worry a lot about assets. We worry a lot about homes, our money, our kids, but we don't worry about our bodies in what it will go through when the dying process happens, when we die. And we know all of us have to die one day. So I wanted to start by asking you a question. How many of you have seen someone die? Okay. And how many of you have taken care of someone who died or who was very sick? Okay. So I want to start with this exercise. You can leave your eyes open or close your eyes, but imagine it's your last few days in this dunya. Last few days, last few weeks, last few moments. Where are you? Who is with you? What does it smell like? What are you wearing? What are you saying? And who you are talking to? And I'm sure everyone has a certain image in their mind how they want to leave this world. Everyone has certain preference because we are human, we have preferences. We control what we eat, we control what we wear, we control what we do with our time. But why don't we think about how we leave this world? And specifically in this time when that process can be controlled, when there are machines, when there's technology that process can be altered. We know we are going to leave this dunya one day, but we don't think about it or don't talk about it, how we want to do that or prepare about it. And this topic is so much discouraged that we have our elderly at home, we have multiple family members who are sick, but we never ask them, what are you hoping for? How do you want to leave this world? Because we want to know our wishes. We want our wishes to be known to our loved ones. We don't want to leave them in a dilemma when that happens. So inshallah, we'll talk a little bit more about it. So with technology, what happened is we started controlling the dying process. So now what we're facing with people are living longer and they're living sicker. So it's hard to distinguish when they're actually sick and when they're dying. Because you get sick, you go to hospital, and you get better, you leave hospital. The cycle keeps happening, especially people who are very sick or who have advanced disease process, maybe cancer or advanced heart disease or advanced lung disease. You can treat it to a certain extent. Last 1 century, we were so focused on finding treatment. Let's treat this disease, let's treat this disease. We can find treatment that we forgot. Dying is still going to happen. There's no cure for death. So we forgot to take care of dying patient. We forgot to learn more about how death happens and how can we take care of those people who are dying. We were so focused on treatments. Let's treat this. It is becoming hard and hard to distinguish when patients are actually sick and when they're dying. Why? Because we don't pay attention to our loved ones anymore. They're in the hospital, we are home, we are busy with our life, they are suffering, they are showing signs. Maybe they know if they are spiritual being, maybe they know they are declining or they're dying, and they may say something to you, but you will like, no Baba, it's okay, it's gonna be okay, we'll treat you. That process keeps happening until body gives up. Remember, there's a time written for death, and Allah will take that body back. And we will have to accept at that point. But if we reflect back and think back, all the suffering and all the pain that we put our loved ones through, back and forth hospital machines, was it worth it? Did we end up prolonging their life, or did we prolong suffering? Because there's a difference in suffering from disease process and suffering from treatments. Treatments these days are not harmless. If I pick one of you and try to put tube down their throat, or maybe poking or hook them to machine, it's gonna be painful. We numb their bodies to a certain extent so they don't show signs of dying, or they cannot talk to their loved ones. So we took out spiritual part of dying, the divine part. Those are the last few moments of this person in this dunya, where we're supposed to talk about, maybe allow them to talk about themselves or whatever they want to say, or connect with God. But we took away that opportunity from them.
There's a specific hadith about the Prophet ﷺ where he says that a person that's nearing that point that we are encouraged to, and it's almost a fard, not a fard, it's an obligation, that you remind that person to say the shahada. And I've been in this room many, many times, not nearly as many as Doc, but I've been in that room many, many times. That person can't hear you. And there's no way with a tube down their throat that they're saying that shahada.
But in their unconscious mind, they know what's going on, though.
Sometimes.
They do. There's certain, to some extent, there is brain activity preserved, but they cannot interact. There are different portions of brain. So they may be able to hear you to some extent. They may be able to hear loved ones. That's why when patients are that sick, we encourage, you may have heard doctors saying, it's better loved ones come, family comes, because they want to be surrounded by family. They cannot say it. But it's better if we do that, because they can recognize familiar voices. Hearing is the last sensation to go. So if you still wanted to talk, if they're on sedation, on machine, if you still wanted to go ahead and say, hey, I love you, or say something, most of the time they are hearing you. And we have actually seen when loved ones walk in, patients show some sign, maybe they will flicker their eyes or move their hands a little bit, and loved ones say, and family say, oh, he's fine, he moved. Why? Because that patient recognized that person's voice and he's trying to interact with the loved one. But that doesn't mean they are there. It's just that brain parts got stimulated when they heard that voice of a loved one.
Yeah, but it's very difficult to decide at what time you will stop giving the medicine and all that.
Yeah, it is difficult, and we'll talk a little bit more, inshallah, when to decide and what is the guidelines like. So when doctors ran into this situation, what they decided? They were like, okay, maybe we should do shared decision making. It's hard for us to make decisions for patient because we can prolong life as long as we want. We built a machine to breathe for the patient. We built a machine, if blood pressure is low, we built medications to have that blood pressure running. If heart is not working, we built a machine to let that heart working. So machine is working for that person. Ventilator is working for breathing for that person. And it can go as long as you want until, body gives up, body starts rotting. We have seen patients who lay on bed for too long, they start having ulcers in their body. And then they develop infection and bugs start eating their bodies. And then we say, I don't think it's working anymore because we won't be able to control infection. The process has started. And then it hits families. Okay, we cannot treat everything. It's still going to happen. So let us reflect on what is Sunnah of dying. Can anyone say, what do you recall from Sunnah of dying? How did our Prophet die? He was at home, surrounded by loved one, right next to, or maybe in the arms of someone who he dearly loved. He was sick for about 2 weeks before he died. He was in the alam of naza. So when we say, it's hard to tell when person is dying, you see some signs if you know person well enough. And they may know some sign too. They may feel like they are nearing towards end. So it is a process. Dying is a process. It's not going to happen one day. Only less than 5% of people die in their sleep. Most of us, more than 95% of the people, we are going to go through a dying process like our Prophet did. He was sick for 2 weeks. So dying process can be as short as 5 days or as long as 3 weeks. I have seen a person entering dying process and remaining in dying process for 6 weeks. And subhanAllah, our science is just catching up. Islam already talked about it, that dying process can be painful, it can take days, it can take longer. Islam does talk about Sheikh, right?
Sakarat al-Maut.
Yeah. It talks about it, and science just is catching up. And now science is saying, death is not a moment. It's a process. It can be days, it can be weeks. So we need to learn to identify that part. And there's a hadith, Prophet Muhammad ﷺ hadith, that find cure for every treatment, but there's no cure for aging. So why it matters? Why ACP matters? So now hold on to the image that I asked in the exercise we did in the beginning. All of you have certain image of how you want to live this dunya, right? Now, think that, have you talked to someone about that image? Did you share it with anyone? Have you talked to any loved ones that this is how I want to die? Do you have a preference?
Yes.
Everyone has a preference, right?
Yeah. But it's not in our hand how we'll die.
Yeah, it can be in your hands. That's what I'm here for. It can be in your hand, because now science is saying that no matter how long we keep you on machine, you're still gonna die. So I will let you decide that part. If you don't want to go through that suffering of 3 weeks of being in ICU and machine, we'll let you decide. Now science has come to that conclusion. I wanted to share a story with you. So a couple of months ago, I took care of a patient. She was in her 70s. She had a liver disease. Back and forth in the hospital, back and forth, coming back, got the tube, got better, discharged, again came back. We fixed her for some time. She spent like maybe 1 month or a few weeks outside hospital, then came back, again, maybe worse or similar. We did, again, she got discharged, then came back. So it was happening over and over. So I sat down with daughter, the family dynamics was this lady, 70-year-old mother, she was staying with her daughter here, and daughter did not have any kids. And she was spending most of the time with mother. They were gardening. Husband used to work. He was not very involved what was going on. And daughter was decision maker. Sheikh, let me know if I'm running out of time.
Maghrib is at 8:30.
8:30, what time is it?
8:12.
Okay, we have time, inshallah. Okay, so this daughter was struggling because patient was not able to make those decisions for her. We sat down and said, this process is going to keep happening. We cannot fix it. She's not a liver transplant candidate. Her body is sick enough, she can die from it. Every time she comes to hospital, we patch it up, put a band-aid. It goes home, it gets ripped. She comes back again. So you acquire a new baseline. You're not allowing body to take its natural course because you're interfering that course. You bring her to hospital, we give antibiotics, we hook her to ventilator, we put the tube. And this lady, poor lady, she's like, let me go. Every time I would talk, she was confused. She's like, it's in Allah's hand. It's in Allah's hand. And daughter is like, no. Continue. And this poor lady is suffering. I sat down with her. I was like, your mother doesn't want to go through it. She has had enough. And we can keep repeating this cycle until she dies in the hospital. You'll be home. She dies alone. And it will be painful for her. And she's confused. She cannot tell me how much pain she is going through, but she's telling me, no. She's refusing. She's like, leave me alone. She's like speaking in Urdu. She doesn't speak in English, but I could understand. And nurses were concerned. All the doctors were concerned. They were like, can you please talk to daughter? So daughter had her own fears of losing this mother. Why? Because this is her whole world. She was holding on to that mother. No, I will be alone. I don't want to let go. She's grieving. So she is thinking about herself, right? Her own feeling. But did she think about what mother is going through? What mother is trying to communicate? So you don't want to be in that situation because your family is going to grieve when that process happened. They are not going to be able to think through things. They are in emotional state. And I could get why daughter was like that, because she was in her emotional state, emotional mind. She was not able to get the gravity of situation. All she wanted to do is hold on to mother as long as she could, because this was her whole life. She didn't have any other family member here except for husband. So I saw this lady suffer a lot, and I really felt badly about it. And then there was another patient, young, 40 years. He was from India. He had cancer, colon cancer. He was traveling to US. He came for a business trip, and he got sick. He came to hospital. And I talked to him. I was like, you have had cancer for a long time, and now it's progressing. Now it's everywhere in the body, and your body is too sick to get treatment. If treatments can kill you faster sometime. So he said, if I can go back to India to be with my family, that's what I would want. But if not, let me go peacefully. And because all the families was in India, it was hard for us to talk to family. There was no one who could make decision. He didn't have living will, but he told me what he wanted. So he got better, a little bit better after some treatment. He still wasn't candidate for cancer treatment because cancer was everywhere. So we discharged him. He left hospital. He was in Uber. He took Uber. He opened the door of Uber and took his first step and fell down. He couldn't even get up. This Uber driver picked this person and went to police station, and police brought him back to hospital. And by that time, he wasn't able to talk to us. He was confused, he was altered. He didn't have any living will. We didn't have family there. Nobody could see. So who's making decisions for this person? We inserted tube, he was unconscious, he went to ICU. We started all the medicines to support heart, to support blood pressure, to support breathing. He was on everything. So we reached out to family in India, and we spoke with wife. And wife said, my husband has had cancer for a long time. He's been fighting for a long time. And he survived when it was Allah's will, but now it has come back, I know. I don't want my husband to suffer. If he wants to go, let him go peacefully. And it was so touching for me that she didn't even think about what she would go through. She was alone, young lady in 30s, 4 kids. She's like, if my husband is dying, let him go peacefully. And I literally had tears in my eyes. So selfless. So selfless. She didn't think about what she'll go through. All she wanted was, don't let my husband suffer. It's his time. We removed all the machine, made him comfortable. He died same day. Some people from mosque came, buried him same day. How graceful and peaceful. Same day, same evening, he buried. And we had a Muslim, a resident. I got to know when he was dying. He went there and he recited Qur'an for him. We planned, because we knew it's coming. We planned. We were reciting Qur'an around him. Someone was holding his hand. Although his family wasn't there, someone sat with him while he was dying and was reciting Qur'an. So if it was other situation, if wife said, no, continue, he could have still died. But would he have died in the same way he died when we planned about it, when we talked about it? No. He could have died random night on machines. Nurses would have been around him, no Quran recitation, no one holding his hand, and family would have received call like he died, okay? So you can control that process if you plan about it. And it's very important you talk to your family how you want to live this world. Because there are machines who can prolong the dying process for you. I often tell my patients and family, we are not prolonging your life now. We are prolonging your dying process. And dying process is painful. So there reaches a point where we cannot fix disease. We don't have life in our hands. Doctors don't have, nothing can. Machines don't have life in their hands. There's going to be a time things can fix, machines can fix, but then it's important to identify when that cycle starts happening and you're just putting a band-aid and it gets ruptured. You're again coming back to hospital, we put a band-aid, you go home, it gets ruptured, you come back. When that cycle keeps repeating and when doctors tell you, that's it, we have exhausted that options, it's better to start planning, because otherwise you would die in hospital on a random night, surrounded by random people, surrounded by machine. There won't be anyone, loved one around you, no one holding your hands, no one reciting Qur'an for you. Maybe you won't get time to say your Shahada. So it's better to plan. So how can you make those wishes known? How can you prevent your kids, your sibling in conflict? No, dad wanted this. No, let's keep going. They're holding on to their own grave. No, I don't want them to die. I want them to live as long as possible. How can you prevent that? How can you prevent that suffering for yourself or for your loved ones? By making sure your wishes are known. They are written. Or the least you talk to your loved ones that I don't want to go through this. I don't want to go through a ventilator. If I'm sick enough to be on a ventilator for a long time, please let me go peacefully. If I'm sick enough that I'm in hospital, let me go peacefully. Or if doctors say you won't survive, your body won't survive until you have a feeding tube, you can make your wishes well known that I don't want to go that route of artificial nutrition. There are certain situations where artificial nutrition can be temporary. I want to mention that, and can be reversible. But if it becomes dependency and consistency, you are dependent, then it's your rest of your life. It's rest of your life. You are going to be dependent on that. It's not natural. You are dependent on machine, you are dependent on artificial nutrition. So talk to someone what you would want. Write it down. So someone else is not making those decisions for you, because you know what you're doing? You're preventing your loved one from that regret. I pulled the trigger. I pulled the plug. I'm the one who made decision for my father or my mother or my loved ones. I'm the guilty one. You're taking away that burden off their shoulder by telling them ahead of time, son or whoever you trust most, whoever you think knows you most, knows your disease process most, let them know so they can speak on your behalf. And they can say, no, my father, my brother would never have wanted this. And then they're not living with that guilt of them making that decision for loved ones. They are not living with that guilt and then conscience and suffering rest of their life. But there's something called 5 wishes, and we'll inshallah go over 5 wishes, and that's what your documentation often say. That's valid in multiple states. So what does 5 wishes document is? So the first wish is the person I want to make care decisions for me when I can't. So know that person. All of us should know that person. Even I often think about it, like who I talk to them. All of us should prepare for it. You should know that person. If someone has 10 family members, 10 kids, or maybe 8, 6, all of them are not going to be on the same page. They are going to make decisions from what they think is best for you. And someone is going to grieve more, struggle more. It's going to be challenging for different people in different ways. So appoint a person you think they know you, they can handle it, they will make decisions the best way, that as if you would make for yourself. So appoint that person, and you can appoint multiple people, not just one. Like you can have primary person, secondary person, they can talk to each other and make decisions for you, or you can even have a third backup. So there's a lot of flexibility in that. So second wish, 5 minutes inshallah we'll finish. The kind of medical treatment I want or don't want. Would you want a ventilator? Would you want a breathing machine to breathe for you? Would you want artificial nutrition when you cannot eat? Would you want to go to nursing home? Sometimes a lot of patients that I see struggle if their legs are being amputated. They say, if you are taking my leg, that's it. I don't want to go that route. So if you have certain preference, whatever it is, if it means that you want to be on ventilator, go ahead. This is who you are, and we respect that. In medicine, there is space for everything. We value your spiritual belief. We value your Islamic values, and we actually often ask for it. What do you think is best for you? There is space for it. Make it well known.